If you're enjoying this MedPrep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called MedPrep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
I had that dream again. My small business needs to hire, but I don't use LinkedIn, and I hire wrong. So then I'm doing IT, and when I go to plug the servers in, they become sentient, and they won't let us access our network unless we forward their chain emails and memes to more and more and more people, and then I wake up.
Don't let hiring nightmares ruin your dreams. LinkedIn Jobs' new AI assistant finds and invites best-fit candidates to apply, so you can discover talent you may have missed. Post your job for free at linkedin.com/quality. Start hiring today with LinkedIn.
Every Who down in Who Newville liked the holidays a ton. But where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one Who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
This is Dr. Ted O'Connell with the MedPrep to Go Step 1 QBank podcast. Today we'll be reviewing 3 microbiology questions. Just a reminder that you can find these questions and many more on our website at medprep2go.com. If you'd like to get involved in this project or have any feedback, please email me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a review, and tell your friends about it so we can get the word out. All right, let's get started with the first question. A 35-year-old woman presents to the clinic with a 3-day history of dysuria, increased urinary frequency, and lower abdominal pain. She denies fever, chills, or flank pain. She has no significant past medical history and does not take any medications. Vital signs are temperature 37.1 degrees Celsius or 98.6 degrees Fahrenheit, blood pressure 118/72 millimeters of mercury, pulse 90 beats per minute, and respirations 18 per minute. Physical examination is unremarkable. A urinalysis is performed and shows the following: positive nitrites, positive leukocyte esterase, and numerous white blood cells and bacteria. A urine culture grows a lactose-fermenting, urease-producing, gram-negative rod. Imaging studies show the presence of staghorn calculi in the kidneys. Which of the following organisms is most likely responsible for this patient's urinary tract infection? A. Escherichia coli. B. Enterococcus faecalis. C. Klebsiella pneumoniae. D. Proteus mirabilis. Or E. Pseudomonas aeruginosa. The correct answer is D. Proteus mirabilis. The patient's presentation with dysuria, increased urinary frequency, and lower abdominal pain, along with positive findings on urinalysis, is consistent with a urinary tract infection. The urine culture growing a lactose-fermenting, gram-negative rod with strong urease activity, along with imaging showing staghorn calculi, strongly suggests Proteus mirabilis. Answer choice A, Escherichia coli, is incorrect. While E. coli is the most common cause of urinary tract infections and is a lactose-fermenting gram-negative rod, it does not typically lead to the formation of staghorn calculi. Answer choice B, Enterococcus faecalis, is incorrect. Enterococcus is a gram-positive organism and does not ferment lactose or produce strong urease activity, nor is it typically associated with staghorn calculi. Answer choice C, Klebsiella pneumoniae, is incorrect. Klebsiella is also a lactose-fermenting gram-negative rod and can cause urinary tract infections, but does not produce strong urease activity like Proteus mirabilis, and is less commonly associated with staghorn calculi. Answer choice E, Pseudomonas aeruginosa, is incorrect. Pseudomonas aeruginosa is a non-lactose fermenting gram-negative rod and would not fit the description provided by the urine culture or the presence of staghorn calculi. The key learning point here: symptoms of urinary tract infection include dysuria, increased urinary frequency, and lower abdominal pain. Urinalysis often shows positive nitrites and leukocyte esterase, along with white blood cells and bacteria. Proteus mirabilis is a lactose-fermenting, gram-negative rod with strong urease activity that is associated with the development of staghorn calculi. Question 2. A 34-year-old man presents to the emergency department with a non-productive cough and intermittent fever for the past 12 days. He also reports nausea, vomiting, and diarrhea. He has been treated with amoxicillin clavulanate for 7 days, but his condition has not improved. He has no significant past medical history. He works as an air conditioning technician. He does not smoke cigarettes and drinks 2 beers per week. Vital signs show a low-grade fever and mild tachypnea. On physical examination, there is decreased tactile fremitus, dullness to percussion, and crackles in the left lower lung field. A chest X-ray reveals patchy left lower lobe infiltrates. Lab results reveal hyponatremia and mildly elevated hepatic transaminases. Which of the following organisms is the most likely cause of his symptoms? A, Klebsiella pneumoniae. B, Legionella pneumophila. C, Mycobacterium tuberculosis. D, Pseudomonas aeruginosa. Or E, Streptococcus pneumoniae. The correct answer is B, Legionella pneumophila. Legionella is a genus of bacteria known primarily for causing Legionnaire's disease, also called Legionella pneumonia. Legionella pneumophila typically occurs after exposure to contaminated water or soil and may be spread by human-made water systems like cooling towers, hot tubs, and plumbing systems. Legionnaire's disease is clinically and radiographically similar to other forms of pneumonia, and most commonly reveals patchy unilobar infiltrates on chest X-ray. Features suggestive of Legionnaire's disease include gastrointestinal symptoms, hyponatremia, elevated transaminases, and failure to respond to beta-lactam monotherapy. Answer choice A, Klebsiella pneumoniae, is incorrect. Klebsiella pneumoniae often causes a more acute presentation with a productive cough, often described as currant jelly and sticky sputum, and may be associated with severe and localized findings, such as cavitary lesions on imaging in the upper lung lobes. Answer choice C, Mycobacterium tuberculosis, is incorrect. Mycobacterium tuberculosis typically presents with a chronic cough, night sweats, and weight loss, and is less likely to cause a rapid onset of symptoms. Answer choice D, Pseudomonas aeruginosa, is incorrect. Pseudomonas aeruginosa typically affects immunocompromised patients, those with chronic lung diseases such as cystic fibrosis, or those who have been on a ventilator. Answer choice E, Streptococcus pneumoniae, is incorrect. Streptococcus pneumoniae is a common cause of community-acquired pneumonia and should respond to beta-lactam therapy such as amoxicillin clavulanate. The key learning point here: Legionnaire's disease, caused by Legionella pneumophila, is clinically and radiographically similar to other forms of pneumonia and most commonly reveals patchy unilobar infiltrates on chest X-ray. Features suggestive of Legionnaire's disease include gastrointestinal symptoms, hyponatremia, elevated transaminases, and failure to respond to beta-lactam monotherapy.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Here's my 30-second story with Guinness. As soon as my sister and I get home for the holidays, we don't even unpack. We head straight to our pub. The bartender already knows our order, Guinness and fries. We laugh all night, catch up with old friends, and walk home with faces sore from smiling. It's one of my favorite nights of the year. That was my 30-second story with Guinness.
Guinness Draft Stout. Please enjoy responsibly. Imported by Diageo Beer Company, USA, New York, New York.
Question 3. A 29-year-old woman presents to the clinic with lower abdominal pain that has developed over the past 2 days. Her last menstrual period was 13 days ago, during which she had mild cramps. She denies any vaginal bleeding or pain during intercourse. She is sexually active and uses a progestin subdermal implant for contraception. She has had 5 sexual partners in the past year. She drinks 2 glasses of wine on the weekend. She does not use any tobacco or any recreational drugs. Vital signs are temperature 39.1 degrees Celsius or 102.4 degrees Fahrenheit, blood pressure 129/71 millimeters of mercury, pulse 128 beats per minute, and respirations 17 per minute. On physical examination, there is cervical motion tenderness and diffuse adnexal tenderness. Speculum examination reveals a small amount of purulent discharge from the cervix. A pregnancy test is negative. Laboratory results are as follows: hemoglobin, 14.9 grams per deciliter, platelets, 260,000 per cubic millimeter, leukocyte count, 16,700 per cubic millimeter, neutrophils, 81%, lymphocytes, 14%, monocytes, 3%, eosinophils, 1%, and basophils, 1%. Which of the following is the patient at greatest risk of developing? A. Alternating strictures and dilation of bile ducts. B. Bridging sclerosis and regenerative nodules in the liver. C. Damaged keratin filaments in hepatocytes. D. Inflammation of the liver capsule. Or E. Portal and periportal lymphoplasmacytic infiltration. The correct answer is D. Inflammation of the liver capsule. This patient has findings consistent with the diagnosis of pelvic inflammatory disease, or PID, including fever, pain in the lower abdomen, purulent discharge from the cervix, and adnexal and cervical motion tenderness. PID refers to inflammation and infection of the upper genital tract in females and can include endometritis, salpingitis, hydrosalpinx, and tubo-ovarian abscess. It typically manifests as an ascending infection from the cervix. The most common causative organisms are Neisseria gonorrhea and Chlamydia trachomatis. Most cases of PID are sexually transmitted. This patient has a history of multiple sexual partners and does not use barrier contraceptives, such as condoms, increasing her risk of contracting sexually transmitted infections. A potential complication of PID is Fitzhugh-Curtis syndrome, or FHCS, characterized by inflammation of the liver capsule, also called perihepatitis, without involving the liver parenchyma and the development of adhesions between peritoneum and the liver. The rate of Fitzhugh-Curtis syndrome is between 4% and 14% in those with PID. Salpingitis in PID can cause some notable long-term complications, including infertility, ectopic pregnancy, and chronic pelvic pain. Answer choice A, alternating strictures and dilation of bile ducts, is incorrect. This finding is seen in primary sclerosing cholangitis, a disease of the biliary tract that usually develops in middle-aged males with ulcerative colitis. It results in the development of concentric onion skin fibrosis on histology and characteristic beading, that is, alternating strictures and dilation of the bile ducts on endoscopic retrograde cholangiopancreatography, or ERCP, and on magnetic resonance cholangiopancreatography, or MRCP. Answer choice B, bridging sclerosis and regenerative nodules in the liver, is incorrect. This finding is seen in patients with cirrhosis. Risk factors for cirrhosis include alcohol abuse, infection with hepatitis B or hepatitis C viruses, non-alcoholic steatohepatitis, hemochromatosis, Wilson disease, alpha-1 antitrypsin deficiency, and autoimmune hepatitis. Complications of cirrhosis include portal hypertension, presenting with ascites, splenomegaly, and portosystemic shunts, decreased detoxification, presenting with hyperestrogenism causing spider angiomas, palmar erythema, and gynecomastia, increased bilirubin causing jaundice, hyperammonemia resulting in impaired mental status, asterixis, and coma, as well as decreased protein synthesis, presenting with hypoalbuminemia causing edema and decreased synthesis of clotting factors, leading to coagulopathy. Answer choice C, damaged keratin filaments in hepatocytes, is incorrect. Many patients with sustained long-term consumption of alcohol develop alcohol hepatitis. A liver biopsy demonstrates acute inflammation with swelling and necrosis of hepatocytes. Mallory bodies, which are intracytoplasmic eosinophilic inclusions of damaged keratin filaments, are characteristic. Answer choice E, portal and periportal lymphoplasmacytic infiltration, is incorrect. This finding is seen in patients with autoimmune hepatitis, a chronic progressive inflammatory condition of the liver due to an unknown cause. It usually presents with an asymptomatic elevation of liver enzymes and is characterized by positive anti-nuclear, anti-smooth muscle, and anti-liver kidney microsomal 1 antibodies. The key learning point here: pelvic inflammatory disease is a sexually transmitted infection of the upper genital tract in females that classically presents with fever, lower abdominal pain, and/or purulent cervical discharge. Commonly implicated organisms include Chlamydia trachomatis and Neisseria gonorrhea. Long-term complications include infertility, ectopic pregnancy, and chronic pelvic pain. Patients can also develop Fitzhugh-Curtis syndrome, characterized by perihepatitis, which is inflammation of the liver capsule, and adhesions between the liver and the peritoneum. Okay, that's it for this episode, but please do check out our other episodes, and a reminder that you can find all of these questions and many more at medprep2go.com. Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.